Hello, my people. Good afternoon, happy Sunday. Welcome back to this channel. Wait, let me ask you some questions. Sister, uncle, especially sisters, have you ever had this embarrassing moment where you know you're not pregnant? You know that you've not just had a miscarriage or a termination of pregnancy,
or giving birth.
and your whole bra and your whole dress is being soaked with a discharge that looks like milk. Or uncle, you were fondling with your partner, you were having a great time, everything was super amazing until you tried to suckle, and then your whole mouth is filled with a discharge or probably with milk.
What type of plane is this?
And you know and you trust that your wifey or your partner is not pregnant. Have you had these embarrassing moments? If yes, then this particular episode is for you. It's meant for you. And a lot of people will tell me, yeah, doctor, I had this problem. I broke up with my boyfriend because he has trust issues, and then he was accusing me of having a termination of pregnancy. He was even accusing me that probably I had done an abortion somewhere and I came to meet him and everything. Uncle, auntie, please, there's something we call Galactorrhea. The spelling is here. So yes, Galactorrhea is a simple thing. Don't worry, don't get your blood pumping. It's very simple. What do I mean by Galactorrhea? Discharge from your breast that looks like milk, that can be whitish in a non-pregnant woman
And non-breastfeeding mothers.
can also be seen in men.
Get out of here. Get out of here, man. Shit, I'm saying.
You are surprised, right? Men discharge. Breast discharge in men. Now, wow. Hey, are you sure it's not cancer? Relax, it's not cancer. Okay? Galactorrhea is not, it has not been linked to breast cancer yet. So we're going to start with what are the causes. So as usual, I'm going to divide it to normal and abnormal causes. So we're going to start with the normal causes. Number one, stress. The female body has been organized or has been designed in a way that stress alters a lot of her hormones. So any form of stress or anxiety can alter your hormone, and one of the hormones that are being affected is the one we call prolactin. Once your prolactin is high, you start seeing that thing that I just told you. So the second one is nipple stimulation. Like,
How fast do we hear of this?
nipple stimulation. Yes, nipple stimulation. When you and your partner have been fondling your breast, it's been sucking, every minute is on that breast, every minute you're fondling it, and before you know it, you will start seeing milky discharge there. Yes, it's normal. Okay, so if you want it to stop, then you have to slow down with the fondling. If you're somebody that takes a lot of herbs, once the herb is out, please, I need this herb.
To hear word.
Okay, this bubotibo, these are if you drink it, expecting that this can happen. Okay, so we're going to jump into the abnormal ones. What are the abnormal causes of this Galactorrhea? Number one, pituitary tumors. Okay, both pituitary and non-pituitary tumors. Big grammar, let me cut it short. So there's a place in your brain that is called pituitary. So if there is a tumor, if there's a growth there, it's going to alter the prolactin levels, and then you start seeing that thing. Okay, so that's number one. Then number two is if you've had a chest trauma before, but whether by road accidents, whether by burns, or you had like multiple surgeries on your chest, yes, you can actually start seeing that. Okay, then if you've had these drugs, example are things like antipsychotics, antidepressants, some sedatives, yes, they can actually cause this. Okay, so another thing is if you're somebody that takes opioids. What are opioids? They are drug of abuse. What are the examples? You don't know examples of this. Good. Heroin. Okay, if you take heroin, if you take codeine, if you take tramadol, yes, you can be predisposed to you having this Galactorrhea. Okay. If you've had
long-standing kidney issues.
Yes, if you've had some, central nervous tissues like brain problems, spinal cord problems, yes, you can have this happening to you. Okay, is what we call hypothyroidism, that which means your thyroid hormone is low. It can also cause this kind of problem. So these are like the causes of galactorrhea. The thing is, does it always come like that? Like, does it just come like you start seeing that? Sometimes it can only present with that. Sometimes it can also present with a lot other symptoms like headaches, okay, like blurring of vision, okay, like abnormal, changes in your period pattern, okay. So yes, it can come with all those kind of things. There's someone that say, okay, so what do I do, doctor? I found this out. So what next? What do I do? Good. The next thing you're supposed to do is to run to the hospital and go see a doctor, okay. Most especially if you're a female, you need to see your gynecologist, okay, so she can do the appropriate test and then start up the appropriate treatment as soon as possible. Okay, some group of people will be like, yes, doctor, but I went to the hospital, they did all these tests and they didn't see anything, and I'm still seeing this thing. What do I do? Are you actually among the 5% people that are called idiopathic causes, which means nobody knows the reason why they're having it? Don't worry, you can still be treated, okay, so that you can still go to your doctor. Your doctor will definitely know what to do for you, okay. Then some people are like, okay, so now we've known all this, are there complications? Are there things that can result from if I don't get the proper treatment? Are there things that can happen to me? Yes, auntie, yes, uncle, there are things that can happen to you if you don't take the appropriate action at the appropriate time. So one of the things that can happen to you is infertility. Yes, I said it. If you're somebody that is looking for a child and then you're having this, you need to go to your doctor for the appropriate treatment, because as your hormones are being altered, it's also affecting your ovaries, and then you can't bring out a very viable egg. So people are like, oh, okay, it's only females. No, it can also happen to a man. That's why if a man, you notice that in your breast, you also need to go and see your doctor so that the appropriate treatment will be started, because it will also, that is even worse, because it's going to lower your sex drive, it's going to reduce your libido, and it can cause erectile dysfunction, which in turn can also make you to be infertile. Okay, so you need to see your doctor. Then another complication that can result from this is you can have some visual abnormalities. Yes, you have some visual defects. Then the third one is, research has also showed that 25% of women that have these particular problems will have low bone density. What do I mean? Their bones won't be as strong as before, and then they'll now start having osteoporosis and bone fragility. Any small thing, they can get fractured. Okay, so yes, these are the complications. So now I hope that you were quite educated. So uncle, please, you can stop accusing her of terminating a pregnancy behind your back with these things, so that you know that it can actually occur in women that are not pregnant. Okay, she may be telling you the truth that she did not have a termination of pregnancy and she's suffering from galactorrhea. So it's just something she needs your support, and then she should be fine once she goes to hospital and gets treated. Okay, so I hope people love today's episode, and I am so thankful for you people liking the videos, and I know that you will subscribe and keep liking the videos. So I'll see you in my next video for another exciting topic.